Thank you so much. I'm so flattered. Being called entertaining or funny is like the best
Yes.
compliment for me. So, and I'm excited you found me on Threads. Sometimes I think one of the biggest things when you're posting on social media, it just feels like crickets and you don't know if anyone's watching or if you're having an impact. So those moments where someone comes to you and says like, I found you here, or, a patient comes in, I watch your TikToks. That's like the
Are
best
you on
feeling.
TikTok as
So
well?
I am. TikTok was my social media origin story. That's where I
Okay,
started
I
for
have to go
sure.
follow you over there.
Yes. So, yeah, I'm a oral maxillofacial surgeon practicing in a small town in Illinois, Quincy, Illinois. I got started on TikTok, early TikTok during the pandemic.
That was the
And
best. Those were the
the
best times, right?
that was the best time of social media, honestly. That organic, really authentic, just connecting to people because we were all stuck in our houses and needing that. I think it really bred something special. But that was why I got started. I was on there and I was kind of home alone, bored. I was out of my practice. I think it's crazy that during the pandemic the whole healthcare sector got shut down. Dentistry as a whole got shut down
Hmm.
except for emergency care. And so I was at home for about 8 weeks, not doing anything related to my job. And I'm on TikTok and I'm realizing there's just this void of dental content, not a lot of information or a lot of misinformation, and also a lot of distrust of our profession or medicine in general. And so that was my mission, to get on, just to start educating and helping and serving.
Awesome. And that's a very good reason to start, is to kind of rebuild that trust and that rapport. Because one thing you said that stands out like a sore thumb is the misinformation. And I see it all the time. I don't call it out because I don't want my accounts to turn into, like, this call out person. And especially, and I'm not here to
Mm-hmm.
give medical advice, but I do
Mm-hmm.
see some of the things that can, you know, not be so accurate. How
Yeah.
do you ever call out any of that, or you just kind of stay in your
Oh, at
lane?
times, social media can be a mixed bag, as I'm sure you've seen. I've made videos where I don't think I'm calling out. I'm just like wading in to offer a helpful suggestion or an education point. And for example, there was a woman, her video was going viral. She hadn't brushed her teeth in 3 years, she said. Every time she brushed her teeth, she had pain and they'd break. And so she felt like, I can't be brushing my teeth. It makes things worse. And I thought I came on responding with compassion and understanding and empathy and like, oh my gosh, that's so hard. And I see it all the time as an oral surgeon. And just know that, when you're ready, we're here to help you. But in the meantime, I know you don't want to brush your teeth, but that's actually like making things worse. And so you really want to brush your teeth. Like the message is brush your teeth. And I had all these people coming at me like, you're the worst. And I would never go to you. And you're terrible. And how dare you say that?
Oh
And
my
it's genetic. She said it was genetic. And, so you have to be a little wary wading in. Some people feed off of that drama, or that controversy can definitely,
Oh yeah,
some
most
people
people
can
feed off the
use
drama.
that to like build up followers and stuff. That's not my point, is to be inflammatory. I'm just really trying to educate and to serve. So I don't wade in too much, but I try to more just, maybe I make a response video that's not like a pointed response, but is my, response to that, if that makes sense.
Yeah, it's your honest truth, and you were offering a suggestion, a solution to her problem. It kind of reminds me. I don't know if you've seen the viral video of the people saying that they don't shower daily. Have you
I've
seen
seen
those
some of
videos?
those, or you don't use a washcloth or things like that, and people just go
Yeah, yeah. So,
crazy.
and one thing that I always tell our clients is that, that even though the algorithm is sophisticated, it does not know the difference between a good comment and a bad
Mm-hmm.
comment. So, in my opinion, if you ruffle a little feathers, you get people a little upset, I feel like your job is
Yeah,
done. I
sure.
mean, and especially when your intentions were great. They were, you had good intentions. You wasn't trying to, make her feel shameful or anything. So, hey, you did nothing wrong in my
I love that.
book.
Thank you. I didn't try to hurt anyone's
Yes,
feelings,
yes.
but
I'm going to always hype you up. Always. Okay. So let's go ahead and get into it. I have three questions for Dr. Erin to answer on our little chat here. And again, The goal is for her to help build you guys up. Anybody that may be watching, any medical professionals that may be watching, if you are not comfortable with getting on camera, or you feel as though, you don't have enough information to share with the world, maybe you feel like you're not qualified, we're hoping to put an end to those feelings by the end of this chat. Okay. So Dr. Erin, what helped you get comfortable the most when it comes to showing up on camera?
Yeah, that's such an interesting question because people will say, someone just the other day, oh my gosh, I love your authenticity and you're just so charismatic and easy on camera. And I'm like laughing inside because I'm like, oh my gosh. I remember as a kid, like before social media, definitely, or even before iPhones and things like that, like on my mom would pull out the camera and I wouldn't do anything. I just freeze. And so being on camera is not, it's not something I grew up comfortable with. It is not something that was in my wheelhouse. And for me, the biggest thing was keeping my goal and my mission in mind. So I'm not showing up to look exceptionally beautiful on camera or to seem like the smartest person in the world, or I'm not trying to impress people is ultimately what it comes down to. I am trying to share my message, which is education and empowerment and all those things, mental health, things like that. And so I only get my message across if I put a message out there, and I have to show up on camera to do that. So for me, when I keep that in mind, then I'm not like focusing so much on like, oh my gosh, where are my 3 double chins showing up, or how was my hair? I don't have to worry about that so much. And then really it's just consistency. It's that practice. The more you show up, the more you put yourself out there, the more comfortable you get. Just exposure therapy. And now I've made hundreds and hundreds of videos. So if it seems like I'm a natural, is that being a natural that you've seen, my 600th video? Probably not. So I think it's normal to feel nervous. I think almost everyone, you'd be like the weirdo, maybe you're like a theater person that just really loves being in front of the camera. But for the rest of us, I think it's very unusual. And that doesn't mean because you're uncomfortable and nervous that you shouldn't be doing it.
Great. And I like one thing that you said was you lead with value. So you know that you're showing up to share value and to educate somebody on something that they didn't know. So it doesn't matter if you have a double chin or if your hair is out of place. And I love that. That mindset that you have is what is a hindrance for so many, because they're not leading with value. They're worrying about their image or how they talk on camera. And then also another element is practice makes perfect. The more you practice, the better you will perfect your craft. And even if it's not perfect, you're still sharing value. Okay. And that's priceless. I love that
Yes.
answer. What is one tip that you would give other medical professionals, or let's just say oral surgeons? What's one tip that you would give other oral surgeons who feel nervous about recording content?
Well, like I said, we're all,
Or many tips, maybe many
yeah, my
tips.
many tips. I think my biggest tip is just showing up as your authentic self. We, a lot of times in medicine and healthcare, we have this persona that we've been told we need to be, this like professionalism. Professionalism is this, and you have to fit into this little box, and it might be your hairstyle or what you're wearing and the way you say things and even the emotions you share, how you interact with patients, how you deliver bad news, and I think a lot of those are kind of stuffy and old fashioned, and social media is an opportunity for us to really show that humanity. Like, don't cry with a patient when you tell them they have cancer. These are like things that we've all heard. This is our opportunity to show that, like, I did go and cry. Maybe I didn't cry with you, or maybe I did. That's my personality. But like, I went in the back and I cried after, and I can show that to people. And I think that when we have that authenticity, that's so important to shine through. That's the best part of ourselves. Our real self is the best part of ourselves that we can offer our patients. And social media is one way to really showcase that, and to help people. I just went to this social media conference for doctors, and it was really inspiring because after a while maybe you start getting bogged down in your why. Like, why am I doing this? Am I doing this for the followers? Am I doing it for the clout? Am I doing this hoping to monetize? Am I doing this to like get famous? Why am I doing this? And for me, ultimately, it comes down to service and education. I'm trying to help people find the right information, not the misinformation that's just pervasive out there. And that's what they were talking about this conference also. Like, they want all of the doctors. I mean, not everyone has to get on here, but they want all the doctors out there helping patients, helping the communities, helping them to find the right information. And so instead of being so worried about if you got it just right or bogged down in the 6 hours of editing, when you show up as yourself, that resonates with people and they can see that and they can feel that. And I've just found the videos that you spend hours on that you're like, oh my gosh, I have the best idea, and you tweak it 100 times and you edit it just right, or maybe you had a professional help you come up with the script or whatever. Those videos don't do any better or do worse than the one that you just like quickly 6-second video, pop it up, so there's no real rhyme or reason. I just don't think it's worth overthinking it. That perfectionistic type A personality that almost all of us has. This is a place to just kind of be
Mhm.
free and open, let some of that go, stop taking yourself so seriously, and lean into the why, which hopefully is just service and love.
Okay, yes. So I love that, be your true authentic self. I know that a lot of medical professionals in medicine, they struggle with that because most of them think that they have to be polished, they have to be professional, but then it's like when you talk about professional, what does that even really mean? Because that can mean different things to different people. So it is all about just having fun, being yourself, getting your message out there. And I like what you said about the conference. They want all the doctors on social media just so you can share your message and guide your patients. And because you know what I've noticed, I won't call out any names, but there are doctors that literally put out misinformation. And I know they know that it's not right. I know that, but whoever their, I don't know, marketing person is or whatever, maybe telling them to do this like rage
Yeah.
bait and just to get comments and stuff,
Yeah.
but I cannot stand it. And I'm like, look, you cannot sell your soul pretty much just to get some clicks and some likes and some followers, because
Mm-hmm.
eventually you're going to have the answer to that. Because if I'm a patient and I see, and I know I have a different brain because I've been in the medical field, and then I also have the
Yeah.
brain of a marketer, but if I see that and I go into your office for services, I'm going to question you, and you better be ready to tell me what's the truth and what's false. So
Mm-hmm.
I hate that we've come to this in our social media society, but it is what it is, which is more reason why we need people like you so that we can better inform the community. So, how has showing up consistently impacted your practice or either your patient relationships?
I think this is so fascinating. Have you heard of like parasocial relationships?
Mm-hmm.
It's this idea that our brains can actually form these relationships, these basically one-sided relationships with people that we're seeing on media, especially like social media. So the more you show up, think of like the people that you follow, that you're a real fan and that you consistently follow their content. Maybe you're even leaving comments. Your brain literally starts thinking that they're your friend.
Oh,
you know?
yes. My bestie in
So
my head.
I know. So you're creating this relationship with them. And, it's kind of interesting to think about the impact of that. But from a clinician side, if I am doing that consistently enough that people, especially in my community, especially if I'm like geotagging my locations, if I'm interacting with more content and businesses, et cetera, in my area, then more people are going to see my content in my direct area. And if they happen to come in to see me, that's such a huge advantage, isn't it? That they already feel like they know me. Like a huge part of dental school was like build rapport, build rapport, build rapport, anxiety reduction protocols. What are all these things you can do to make the patient trust you and like you and feel like they know you and feel like you care? All of that is done before they even walk in the door if we have a parasocial relationship. So they are seeing me as someone they can trust, They're seeing my human side. Maybe I've made them laugh, which that doesn't happen very often when you're thinking about coming in and having a tooth
I
out. Most
know, right?
people are not laughing.
They are scared and they have so much
Yeah.
anxiety. I know, I know.
And so they already know me, and I think that trust is already inherent a lot of the time. And then they can walk in, and when I suggest something, they're much more willing to accept the treatment. Or maybe they've heard me talk about it before. They've heard me talk about when you should have your wisdom teeth out, or the complications, or a dry socket. And so they see me as a trusted expert. And I even hear sometimes doctors will make content, and we spend so much time talking about like informed consent, post-op complications, blah 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 blah. Sometimes what they'll do is they'll like give their patient the iPad, and they'll load a
Yeah,
video that they made on social media, and then that can all be there too. So there are some like time saving things that you can use in your practice beyond that. But I think that ability to connect with the patient passively before I've ever even met them is so invaluable, and what a gift, especially in professions like dentistry, for example, where patients are overwhelmingly nervous, high anxiety, maybe distrustful. But I will say there's a little warning to that. And again, to plug the authenticity side, I think if you're not showing up as your true self, and they come in and who you are in person is not who you are on camera,
hmm,
that's going to be a big jarring effect. And it might have the complete opposite effect where they're excited to come meet you. And then if you're not who they thought you were, they might be disappointed, or have the opposite effect where they don't trust you anymore.
absolutely. And I think we all have probably experienced medical professionals like that, that they put on this show for social media, but then in person, they're like dry as a box of cardboard. So I
Mm-hmm.
get that. And social media does do that. It does the heavy lifting for you. And again, especially in your specialty, everybody's nervous or they have some sort of misinformation about what to expect when they go in.
Yeah.
So by you tearing down those walls and building those relationships, that would just make, me as a patient, that would make me more likely to trust you and come in and say, okay, Dr. Erin, you do whatever. You're the expert. I'm here. I just want this to be an exceptional experience. And a lot of people don't really understand the power of social media and how it just breaks down that wall and it builds the relationship with the provider before you even step foot in the office or with the
Mm-hmm.
office team. Like another thing that I'm
Sure.
always stressing to my clients is include your team, put your team on social because they are a part of the brand story as well.
Yeah.
Well,
Sure.
let's just say that they're not, they don't have like a high turnover rate because I've dealt with offices with high turnover rates too. But the ones that are solid, patients would love to see that smiling face on the internet and then come into the office and see that same smiling face and so many people take that for granted and they think that, oh, that's not a
Yeah.
big deal, but it is a big deal. It is a
Yeah.
huge deal.
I think that's a really good tip. I love that.
Yes. So, do you have any exciting things that you want to share with our listeners? I know you were telling me about a retreat. You want to talk about that?
Yes, so I am launching my second year of a retreat for women oral maxillofacial surgeons. It's called The Doctor Is All In. It's essentially continuing education done in a different way. I have been to so many like mega conferences where you walk in and you're one of like hundreds or thousands, and you feel like you just kind of get lost in the crowd with content that has nothing to do with you or your practice. And I wanted to create a whole other experience. So it's an intimate event for 30 women. It's at the Miraval Austin Resort, which is a fabulous all inclusive luxury resort. And so we're doing things like a ropes course, where we're climbing up and doing crazy activities together, team building and leadership building. We're having time for you to get a massage. We are maybe country line dancing, and then talking about things that I think are high impact for not just like the academic side of your practice, but for you holistically as a person. And that's why it's called The Doctor Is All
Mhm.
In, because I want it to be like a full wellness event for you. So we're working on mental health things and practice building and your physical health and all those things. So when you leave, you're not just like bored or frazzled and trying to get caught back at work after being gone, but you're feeling energized, refreshed, and ready to like conquer the world. So that's really my mission with that. And so we're really excited about it. If you're interested in coming, it's you can go to the doctorisallin.org, and it's designed for women in oral surgery, but honestly, any doctor who feels like this is something that sounds great and feels called to come, please come. It's not like all dental surgery content. Again, most of it has nothing to do with any of that. So anyone is welcome to come, but it's going to be amazing. It's our second year. It was awesome.
Do you have a separate Instagram account for this? Oh,
Yeah, it's also the doctor is all in. So if you go there, you can follow and get all the updates. But it's gonna be amazing. It was literally like life changing last year.
I bet.
I know I'm the founder, but I love going as an attendee. I can't wait to go back.
So you're just going as an attendee. You don't do like the teaching and stuff?
I did lecture last year. I may do a little bit this year, but trying to give some other voices a platform as well.
Awesome. I love that. You're going to be perfect. It's going to go perfect. I know it'll be a great time, especially you said it's your second retreat, right? So you only get
It's
better.
been
You only
proven.
get
Yeah,
better.
for
And
sure.
then how about your
Yes, it's
podcast? You want to let us know about that?
yeah, so I recently launched our podcast. It's called The Resting Stitch Face
Oh, I
with
love
my
that. Wow.
there's a
I
lot
like
of
that.
messaging behind that. And that's with my co-host Dr. Sarah Harding, who is an oral surgeon in San Diego, and we're really excited about it. Essentially, it's not just another like surgery medical podcast where we're talking about how to lay a flap or how the best way to stitch or any of that. We're not talking about those topics. Those other people are doing that, and that's fine. I would say it's more of a lifestyle podcast. We're just talking about like what's it like to be as a woman in a busy career? What's it like as a woman surgeon or a woman doctor? How are we managing all of the things? What are our hot takes on
Hmm.
different topics? One of our most popular episodes is on imposter
Oh,
syndrome,
wow.
or
Okay.
we talk to a woman lawyer who helps doctors and just, the common pitfalls that we might run into in that way. So it's really just more kind of the life of being a woman and being in medicine and our hot and embarrassing, authentic, vulnerable
Yeah.
selves. So
Well, it sounds like to me because you're not limiting yourself to just the typical oral surgery vibes and content, you are allowing more people to come in because you're speaking on relatable topics that most
yeah.
women, in the medical professional, that they're having to juggle and they're having to,
Mm-hmm.
figure out how to navigate. So it's not just for seasoned medical professionals, but it can be for those ones that are up and coming and they just need guidance. So that was smart on you guys to, not put yourselves in a box.
Yeah, very smart and calculated maneuver.
Yeah,
We
I
just like to
understand.
talk.
The resting stitch face. Is there a rhyme or reason with that name? I must know. It sounds like there's a deeper
Yeah.
meaning.
I mean, part of it, I just wanted something a little cheeky because that's kind of who we are, kind of in your face and irreverent. And then, we're face doctors and stitches and surgeons and all that. That's like the surface level. But I think there's so much wrapped into it because you think of the term resting bitch face, which is where we got the inspiration from. And just this idea that as a woman, just living your normal life, people are like criticizing how your face just normally is,
Oh
and
yeah.
there's a lot to that, being a woman in the world and how we're being judged and the standards we're being held up to, and then add in the layer of being a woman surgeon and the distrust that comes with that, a lot, the discrimination and the harassment that many of us have faced. We've been told we don't belong in that space for so long, and so it's just kind of
Mhm.
like a funny punchback on that idea.
And you guys go follow Dr. Erin. Go check out her retreat. Get you some tickets and definitely go because it sounds like it's going to be an amazing time, an amazing experience. And then also go and listen
Yes.
to her podcast because you definitely just got a new listener out of me. Yes.
Oh, I can't
And
wait.
again, just thank you so much for being here. You guys, if you didn't learn anything, here's your takeaways. Be your true authentic self. Everything doesn't always have to be perfect and polished. Have more fun, and that fun will lead to fulfillment. It is literally that simple, right? So, thank y'all for watching. Go follow Dr. Erin. Go follow me. Subscribe to this channel, and I will see you guys in the next video.